We've talked before about how there are sort of benign conspiracy theories, and then there are conspiracy theories and disinformation that, when people believe them, have very, very real world consequences. And with coronavirus, the disinformation and the conspiracies have very real repercussions. If you don't accept the science and you don't wear a mask and you don't social distance, you keep having indoor gatherings, people get the virus and some of them die. The repercussions are very real. Now, you might have heard that Utah's coronavirus numbers are exploding so badly that their Republican governor put in place more guidelines and a mask mandate and explained that many hospitals are nearly full or completely full. Utah's case numbers have been spiking dramatically. They're now up to about 3,000 cases a day. That's a ton for a state with only 3 million people in it. Deaths are also up, although not as dramatically for now as the cases, although that could change as the hospitals are increasingly full. We know that the death rate tends to go up when that happens. Well, there are people in Utah, one of the most right-wing states in the country, that think it's all a lie. What I mean is they don't even believe that the full hospital is really full, and certainly not with coronavirus patients. Conspiracy theorists started driving to Utah Valley Hospital in Provo, Utah, claiming that the parking lot is so empty, the hospital can't possibly be full of COVID patients. So what did they do? They didn't just stay in the parking lot. They invaded the hospital. They entered with video cameras to document what they believed would be a completely empty intensive care unit. Now, fortunately, these people did not actually get access to the ICU. That would have been just, even more insane. But had they been able to get to the ICU, they would have found a full ICU with coronavirus patients, nurses and doctors and staff under huge strain from dealing with a full ICU and the pandemic. Now, the reason that there weren't many cars in the parking lot is because there are, number one, huge restrictions on visitors at hospitals right now because of the pandemic. Also, many of the people in the hospital with COVID didn't drive themselves to the hospital because they were too sick. So they don't have cars there. Guests aren't allowed, so guests don't have cars there. That's why the parking lot seems relatively not full. Things are so bad in Utah that they are recruiting medical professionals from out of state to come in and help, and expediting credentialing out of state medical professionals to be able to work in Utah. Imagine for a second if these people put as much time and energy into coming together to deal with the pandemic rather than invading hospitals. Imagine how much better off we would be. Imagine if these people, when we learned about the virus and understood that cases were rising and how it spread, imagine if all of these so-called truthers and skeptics and deniers actually did something to help the situation rather than hurt it, like distributing masks as an example, or figuring out, a grocery delivery service, maybe for elderly folks who aren't as comfortable with ordering Amazon Fresh or delivery services or whatever, to get groceries delivered so those folks could stay home, and reducing the number of elderly and at-risk people who get I could go on for an hour just saying almost anything that they, even just staying home themselves, right? Almost anything they could have done other than doing this skeptic stuff and trying to invade an ICU to get video of an ICU they expect. Doing nothing would be better than what they are doing. And imagine if these same people, these types of people, put as much time into dealing with any societal problem. Like if we had the conspiracy world dealing with climate change, if we had the conspiracy world deciding, hey, you know what, we're going to eradicate hunger, like anything, if the conspiracy right was helping us rather than working against us, there are so many problems that we could have solved at this point in time. And it is really tragic. And, in the same way that I talked about earlier, how do you deprogram nearly 75 million Trumpists? And we talk about Trumpism as a cult, and we've interviewed Stephen Hassan about how Trumpism is like a cult in many ways. In that same way, how do you deprogram the COVID people? Now, one of the things we have talked about is when cultists and conspiracy theorists start to see that their beliefs have consequences at scale, sometimes that will deprogram them. With COVID, there's a very clear path there, right? It's I'm a denier, a relative gets sick and or dies from COVID. You are deprogrammed by seeing that your skepticism at scale has consequences and that people die. And we saw examples of that. If you think back to the Democratic National Convention, there was a woman whose name I forget now, but who spoke very passionately about her father, who was a Trump supporter almost to the very end, didn't believe that the virus was serious, got COVID and died, and that this changed his worldview. It changed her worldview and that of some others. It can happen. But you still saw at Trump rallies, even days before the presidential election of a few weeks ago, people with shirts that said, you know, my cousin died of COVID and I still support Trump. I mean, like, you know, boisterously and extravagantly and aggressively flaunting their ignorance. Really, really sad stuff. But this stuff has real consequences, and we are seeing it very much so. When you see me sitting here at the microphone, oftentimes I'm wearing a shirt by a company called Teddy Stratford. And I love these shirts so much that I asked Teddy Stratford to be a sponsor of the show. And here's why I like their shirts so much. With other slim fit button-up shirts, you often get this weird looking gap between the buttons where it looks kind of stretched out. But Teddy Stratford actually has a patented zipper that's hidden underneath the buttons, which secures the shirt against your chest so it doesn't look stretched. And most importantly, it just provides a nicer looking fit overall. And the entire shirt is specially designed to really improve the way your upper body looks when you're wearing it. It also has a special type of collar that prevents it from drooping down and spreading open, which is another really great thing about these shirts. All of these things really do a lot to make a big difference when you're looking at a shirt. And that's why I like to wear Teddy Stratford shirts on the show. Go check them out at davidpakman.com/Teddy. The link is down below, and they'll give you 15% off your first order if you use the coupon code Pakman at checkout.